Okay, welcome everybody. I'm Zoe in Beijing, CGTN anchor. As we understand, the global war against the coronavirus intensifies, and science and technology are obviously taking the lead in the fight. So what are the latest developments? How exactly technology helped to contain the outbreak, and what is the role of technology in public health? To talk about all those issues and more, today I'm honored to be joined in our live webcast by experts from China, Algeria, Portugal, Malaysia, and Norway. And viewers can also participate by leaving your questions or messages in the comment section of our social media account. The world is obviously struggling in their own way to cope with the coronavirus epidemic. As more and more countries are under lockdown, some people in China are returning to work. So let's first begin with Mr. Gu Fei. He's a senior algorithm engineer at Alibaba Group. He will talk about the life and work after coronavirus. Gu Fei.
Hello, everyone. Hello.
No.
So how your work at Alibaba will begin every day when the coronavirus is still looming?
Yes, so I think at the beginning of this month, as the newly diagnosed patients numbers reduced a lot, and so we are planning to go back to work. And we set up some systems so we can work safely. So first, we are required to stay at home for the isolation for 14 days. And after 14 days, we are eligible to go back to campus. And also we have set up some checkpoints. I will switch my camera. So here we have this temperature checkpoint, and as you can see, we have all those sanitizer and also the thermometers. So I will try to go into the campus after the temperature test. So everybody, the temperature below 37.3 Celsius is allowed to go enter into the campus. And after swipe my badge, I go into the campus. And as you can see, everybody here, cause it's we are still at work, so not too many people in the streets. But you can see everybody wear the masks. Our company offers masks per day. For every employees. So now I'm going to my working space.
To your office, Mr. Keep us posted. What is it like going to work at this time of coronavirus? And then I'll introduce each and every panelist at this webcast broadcast. And please introduce yourself, and also what is it like in your country? How do the people there respond to the pandemic? Why don't we start with Dr. Hanafia?
Hi, thank you so much for having me to be part of this panel discussion. So very happy to share our recent experience in Malaysia here. So we've just entered our second week of having a movement control order, and that's because we had a second wave of outbreaks here in Malaysia after there was a large gathering that had some international attendees as well, and now we've got some community spread. But I think the order has allowed us to actually track the progress of the outbreak and hopefully slow it down, and we're aiming to flatten that curve by ramping up testing as well. But we've also just heard word that the order is going to be increased for, I think, another week. So just trying to hang in there and keep our spirits
So is everybody stay at home to work, or they can still go to their offices?
So the government has outlined essential and non-essential services. So those who are deemed in non-essential services, or those who can actually perform work from home, are all required to work from home. And there are also police and military patrolling to ensure that as much compliance is achieved as possible. The grocery stores are still open. I just did my grocery run a week ago. And so we have the people working at the supermarkets, of course, and of course our wonderful frontliners who's really, I don't know, braving through this unprecedented epidemic. So obviously they're still working.
Are people cooperating and stay at home as much as possible, or still people who are on the street?
So I think there was some confusion in the beginning, but people are understanding. Like there's been a lot of communication about why it's important and why this measure had to be taken. So there is more and more compliance. And if I look outside, I do see every day. So I think people are getting used to this new way of life that we have to go through in order to battle this epidemic.
All right, let's go to our next panelist, Mr. Patterson, Director of Communications for Norwegian Institute of Bioeconomy Research. Mr. Patterson, right there.
Yes, hello from Oslo, Norway. Now we are in the second week of quite strict restrictions in Norway. So here it's every university, every school, kindergartens, they have closed, and people are urged to work from home. So as of today, I guess that at my workplace, for example, about 80% will be working from their home office, which is challenging, but so far it's working okay. And the society as such is still functioning, but the restriction of movement, for example, is there, and our borders, if you come from abroad, you have to go into a 14 days quarantine, for example, and there is also quite strict restrictions on movement inside the country.
And because those European countries, big European countries like Germany, France, and Italy are facing a very severe problems of infections, what about Norway? Are there infection cases also going up? Is it still in the period of containment?
Yes, you can say so. We are still in an early phase, and because of the restrictions, we are trying now to flatten the curve, as we say. So we have a population of 5.5 million, and today we have maybe close to 2,500 infected that we know of. And we are working to flatten the curve and to give the health service the time to prepare for more infections. So far, that seems to have been working. And the government yesterday, they decided that the restrictions are to last for another 3 weeks at least. Sorry.
3 weeks at least.
Yes.
All right. Let's go to our next panelist, Professor Thomas Kraft, co-chair of the Commission on Environment and Health of the International Geographical Union. So, Mr. Kraft.
Yeah, good morning. As you mentioned before, I'm currently in Portugal, but actually I'm German and at the Dutch university. So I'm actually based in Maastricht University, at the Faculty of Health and Medicine. But I'm currently with my family for a sabbatical at the University of Coimbra. And due to the containment measures, we are not able to return. We are in a small village close to the sea near the city of Coimbra. Everything is very calm. Portugal has also enforced strict movement measures, control measures, and universities, kindergartens, schools are closed, similar to the situation in Norway. Portugal was really concerned because one country that is really struggling at the moment is Spain, the only land border that Portugal has, and so they're really concerned that it will also spill over. At the moment, we still see a rise of. We also need to keep in mind that containment measures always show results with a gap. So it's interesting to see how the containment measures that are really strictly enforced will turn out in a week's time or so. And what I can see as a guest in this country is that the Portuguese population is extremely understandable, very cautious, polite, and really strictly following the orders to stay at home and avoid unnecessary contacts.
Now we understand Mr. Gufei is already at his desk in Alibaba. So you've been through all the temperature checks and walk into this. Can you tell us what kind of work do you do? I know you are algorithm developer, but how is it related to coronavirus diagnostic process?
Yeah, during this virus epidemic, we have developed a bunch of AI tools to help to diagnose from either the image or from the genome. So I will briefly introduce 3 of our tools.
Can you be a little bit closer to the microphone and louder?
Yes. So is it better now?
Just be a little bit closer to the microphone.
Okay, so yeah, so I will briefly introduce 3 of our tools, AI tools, used in this coronavirus epidemic. So it's okay now?
Yes.
Yes. So yeah. So for the first one is this, and I will broadcast a video and. First, we select a patient and under diagnosed, so now the risk value is here, and it's almost 99.99%, and it's very high risk. And then we'll go to the CT images, and so we can select some of the slides of the CT images, and we can see that. Some of the regions that has been highlighted by the box, red box or blue box, it means those regions are related to the, it's maybe affected by the virus. And so this is one of our technology, and the second one is the
So you are telling us that we're using a computer to read the CT scan of lungs. Is that the
correct?
Case?
Correct.
How accurate and how effective is that in comparison with human reading?
Now the accuracy is around 97%, and it's very fast. It can be the report can be generated under 20 seconds. So usually a doctor, it will take a doctor 15 minutes to get the report. So it's much faster and very accurate.
Go on.
The second,
the second one.
The second one is the whole genome sequencing system. So after we log in the system, we have a bunch of functions, and first is the sequencing analysis functions. And this is one report. We can get the numbers that are generated from the virus, the sequence numbers generated from the virus. And then we are required to generate the sequence itself for the sample, so that we can compare with the virus. So we generate a coverage and a length and the similarity of the sample, tested sample sequence, and by comparing with the real virus sequence, we can get the diagnostic report for the patients.
We have another panelist from Algeria on the line, Mr. Boukaba, Mr. Barak Boukaba, the Honorary President of the National Union of Algerian Technologists and Scientists. Mr. Boukaba, can you hear me? What is it like in Algeria?
In Algeria now we have 264 cases and 19 deaths. And we think that the epidemic will still grow in the next days and weeks. All cases come from outside, especially from France and Italy. This is the situation now in Algeria. The government give instruction to people to stay at home, and we are staying at home. Only the important function for food and medicine and hospital are working 100%. All others are working less than 25%. So we are in the same situation like
in Algeria. All those cases are imported cases.
Yeah. All cases are imported in the beginning, but now is also some locals. In contamination now can be also locals, but in the beginning there is one case from Italy and 2 cases from France, and now we have 264 cases and 19 deaths. So the government give instruction, very strict instruction, to people to stay at home and to stop the infection, to stop the dissemination of the infection. We are waiting the few days, in few days and few weeks to see the result of this confinement. We hope that this confinement will give very quickly the good result. This is the situation now in Algeria.
I promised in the beginning we will answer questions from viewers and social media users. I have this question from Claire Frompt. She said, how should I deal with the anxiety about the coronavirus? I feel very much stressed. I probably want each and every one of you to give your take on how should I deal with the anxiety. Dr. Hanafia, what is your take?
I mean, I think if we look throughout history, epidemics, pandemics, viruses have come and gone. And if we think about the predecessor to the virus that causes COVID-19, the SARS coronavirus 2, that caused an epidemic, and then it now is no longer a concern of ours. And so there are a few scenarios. I mean, I think what's really positive is that for the first time, the whole world is really united in trying to address this virus and finding ways that we can contribute towards reducing the rate of the spread so that we don't overburden our healthcare system. And that's as simple as everybody just trying to stay at home, trying to work from home, learning from home when they're not going to school. And I think if you can channel your anxiety to doing something productive, and then I think you will find this period will pass eventually. There will be an end to the epidemic because this is a very standard thing that happens with epidemics. It will end. The question is, after this, will this become like a seasonal flu where it'll be just around and we just need to manage it? And if we buy ourselves enough time, we'll probably get a vaccine because there's already a lot of good work, a lot of positive developments on that front. We're getting diagnostics faster than ever, and we just need to test them to see if they work. And I think really the positive thing is so many people are working on this that we will get through it, I think. And there will be some really important lessons for us.
Important point. And Mr. Patterson, people not only are about the uncertainty of the response to the virus, but also their lives and their livelihoods, and whether they will lose jobs, what is in store for them. What is your thinking on that?
Yeah, this is a huge challenge, and it depends very much on the country, where you are, what are the baseline. And I think that we in Norway, we are in a better situation than many others. We have a pension fund, as we call it. So there are savings from the state that can be used in times like this. So for the time being, it's a lot of people that are out of work, but they're not out of means to live for. So they will be taken care of in the short term. In the long term, a lot of things will happen as a function of this crisis. I think society will change. So, but to your question about being worried, I think that public science literacy is crucial in times like this. You need people to understand what is happening and to have a basic understanding of science, of how this works, and some trustworthy sources where they can find this kind of information. So that is, I think this is a medical crisis, but it's also a huge, huge communication challenge, because if people are not given the right, call it information, we will have a huge problem. And there are a lot of misinformation also in a developed country like Norway. So I think that is part of it, communication and also the medical part of it.
Question from the net users, Vincenzo Perrotta. That question actually we touched upon a little bit earlier. He asked, even those developed countries can't stop the virus, how can the developing cope with that? Their health system are poorer. Is that going to be a huge humanitarian crisis ahead? I think this is a legit concern. How should those developing countries, especially those with not so robust healthcare system, deal with the worst scenario if it is the case, God forbid?
I think that the worst scenario is a developing country is that nearly 60% of population will be infected. And the immunity can be, have this immunity. But unfortunately, many people with other disease will die. This is the problem. But I see that in many developing countries, the government have a good action to stop the spread of this epidemic by asking people to stay at home, don't go outside. This is the best thing to do, because hospital logistics for health hospital is not enough. So the best thing to do is to stay at home and to isolate the virus and the spreading of the virus by staying at home. This is the only what we can do in this country. We also waiting with a good hope if any medicine can be put on the market. Now there is some medicine like chloroquine. Chloroquine now is very, many people speak about chloroquine, and the situation is not clear for chloroquine, but many specialists, many very good doctors say that this can help very quickly the people, especially in Africa. In Africa, chloroquine is very popular because chloroquine is for malaria. And many people in Africa take chloroquine normally from many years. Maybe for this, they don't have so much infected. Maybe, I'm not sure, I already say this. So we have a great hope about this new medicine, because for vaccine need time, need at least for a developing country at least 5 years to
5 years. Some say 18 months.
No. I mean to cover. If the scientists discover today a good vaccine, and for which virus, the virus can mute, can change every time.
We are almost running out of time. Before I wrap up, I'd like each and every one of you to use one sentence to say what is the biggest lesson we learned from this coronavirus outbreak. Mr. Gu?
Yeah, I think we need to emphasize on every disease at the very beginning of the stage. And after that, people, the government should work efficiently to calm down people and to get the patient to be in the hospital as soon as possible. And other people who don't have the disease should calm down and stay at home.
Okay, your voice is a little low. I get that the government should respond faster. Dr. Hanafia?
Well, I mean, this is basically our first big pandemic in the age of social media, where we've been complaining, this is the modern age, people don't interact enough. And now we're actually forced to only interact largely through social media, through technology. And it's been, I think, a very reflective period where, I personally thought about what I actually need to live and what I don't need, how much space is it actually that I require, and also just how I think about science in general, and actually how the science community is shifting their priorities to meet this common enemy. It was actually World TB Day yesterday on the 24th of March, but the address that the executive director gave was about battling COVID-19, because this is our challenge as a global community. And that's very rare. Most experts will just talk about their disease of interest. So I think it's a good lesson in our humanity.
Yeah. Mr. Patterson?
Yes, I mentioned earlier, I think that science literacy is crucial. It's also a kind of a vaccine. If we have a people that is science literate all the way to the decision makers, that will make us more able,
especially politicians.
Yes, and to see what is coming and to prepare for the unthinkable. I think that is an important lesson.
Yeah. Professor Kraft?
I think the lesson is that we need to strengthen public health systems across the globe in the time where we have money and time to do this, so that we are prepared, and we need to understand that we are all in this, and that we have to show solidarity and support also to those that have less resources. So more international collaboration instead of national perspectives.
Yes, indeed. And Mr. Bukaba?
Yes, this disease demonstrates clearly that the world is a small village. And we also see that the United Nations organization is not efficient to coordinate the action in the world. The Organization of Health in the world also is not very efficient. So I think after this corona is not like before this corona, and the world need to be restructured, a new structure, a new international structure for better cooperation. Yeah. As you know that AI and artificial intelligence need that all countries join their information to have the very, very big data to find the solution in very short time. So what I think is what we need to change the rules in the international relationship, and to be more fair and less war, more development and less war.
Yes. Well, yes, indeed. Before this virus, we thought we were the smartest and most capable species in the world. But this is definitely a humbling experience for all of us. We must work harder in face of the invasion of a virus. Thank you very much, my dear panelists. Thank you for your wonderful insights. And that will wrap up this webcast of our debate on the global response to COVID-19. Thank you so much.